my name's Caitlin. I'm going to be your student nurse today. Can you tell me your name and date of birth? Mr. Tommy Brown, 214XX. Thank you. I'm coming in to give you some medications. The first thing I'm going to be giving you is an antibiotic. It's cefazolin, and you just have some elevated white blood cells, so that indicates you could have an infection. So we're going to go ahead and get you started on the antibiotic, okay? It should take me like 10 or 15 minutes to do this one, and then you have another medication for your anxiety that I'll give afterwards. So in total, I'll probably be in here about 30 minutes, okay? Do you have any questions? Is there anything that I can get you before we get started? Okay, so I've got all my equipment here, and I'm going to be giving cefazolin. The cefazolin is... we're going to be giving in 1 gram. It's it's compatible with the 0.9% sodium chloride, and the order wants us to dilute and reconstitute it with this 50 milliliter bag. So that's what we're going to be doing. The fluids that are already set up are also 0.9% sodium chloride, so that is compatible as well. All right, so I've calculated the flow rate based on the order, and we'll be giving the antibiotic over 30 minutes because it is a 50 milliliter bag. The drug guide stated that a 50 milliliter bag or a 100 milliliter bag could be used, and it could be given over 30 minutes to 60 minutes. So I will be setting the pump at 100 milliliters an hour because it is 50 milliliters, so 30 minutes, half and half. All right, so can you just one more time state your name and date of birth for me? 214XX. Thank you. And do you have any allergies? No? And that matches. So I'm going to be doing my first check. We've got the cefazolin, 1 gram. Cefazolin, okay. Now I'm going to check for the name again, cefazolin, and the expiration date, and it is within the expiration date, so we're good. I have confirmed the patient, the drug, the dose, the route, which is IVPB, the time, which is now, and no allergies, so we're good there, and the birthday. All right, so I'm going to wash my hands and get started mixing the medication. So I already did check this, and the patient, the time, the route, everything. Okay, so those are my 2 checks, and those are done. Let's see, I'm gonna go ahead and label my bag here. No, I don't want to use this one. I'll label my bag so that I have the had a label with, oh, there's my pen. The patient name, the time, medication, and dose, and all of that. Put it where it will not be in the way. Okay. So wash my hands. I'm going to get this ready. So I pop this cap, perhaps, and throw that in the trash. And then swab this for 30 seconds. Vigorously. And trash. And then I'm opening this so that go. And now I pop this. And that goes in the trash. And alcohol swab this. 30 seconds. And trash, and I let it dry. And then I'm going to attach this end. And begin mixing. I want to swirl it so that it doesn't make sure I reconstitute all of it. So I've labeled it and we're good to go. So I'm going to check my the name of my medication again with the vial, and it is cefazolin. Cefazolin on my label, cefazolin here. All right, and can you tell me your name and date of birth one more time? Scanning my patient, 214XX, thank you. That matches, and then I'm scanning my medication barcode, and that matches. Okay, now I am, Mr. Brown, I already told you about the cefazolin. It's for your white blood cell count. If you have any of these side effects, just give me a call, okay? It could cause you to have some diarrhea, nausea, vomiting, pain at your IV site here. If you get any irritation or pain, give me a call. If you feel nausea or vomiting, give me a call. And if you get any rashes starting, okay? All right, so now I'm going to open my secondary line here. Don't need that plug yet. And I'm going to peel this off. Without touching anything. I'm gonna take this cap off and put this in here. And I already checked the lower clamp too. As far as it's going to go. Okay. All right. Now I'm going to check my IV site and find the Y port above the pump. My tube needs a label, so I already created one, and I'm going to put it on here. Alright, I've labeled it. And there is no redness, swelling, signs of infiltration, or phlebitis noticed at this IV site, and the dressing is clean, dry, and intact. I'm going to pick my line here, and this is the Y side above my pump. So I'm going to clean it for 30 seconds with alcohol. Seconds, scrub it up, trash, and not touching anything. Get this cap off, this on. Now I'm going to use the back flush method, and I'm gonna let the primary fluid here get into this line to get rid of the air. So I'm gonna unclamp this. And that's good. About 3/4 full there. Okay, and my green hanger is gonna be used. I'm going to put the primary fluid below the secondary fluid here, the medication. So use this to hang it lower. Alright, and again, just to reiterate, I'll put this at 100 milliliters per hour, which this was already set up as, so that's a good rate. Okay. I'm going to start this pump, and I'm going to gather my supplies to get my other medications ready after I document the administration of this medication. So I've done all of that. And we are now going to start the administration of the lorazepam push. So let me get my supplies together. Everything right here. Alright, so for this we're going to be giving you, Mr. Brown, some lorazepam for your anxiety. And I have checked already with the drug guide and the MAR that it is compatible with the ordered solution of 0.9% sodium chloride here, and it is compatible with everything that's already going into Mr. Brown's IV. So for the lorazepam, the drug guide said that 2 grams could be given over 1 minute, and 2 grams is 1 milliliter of the liquid. So we will be giving 1 milligram of the lorazepam diluted with milliliter of lorazepam, and 1 milliliter of the 0.9% sodium here. And when that's finished, it'll be 2 milliliters, and I'll give that over a span of 1 minute, or 0.5 milliliters every 15 seconds. So I'm going to wash my hands and get started with that. Mr. Brown, do you have any questions for me? No? Okay, I'm gonna get started. So, I'm gonna check my order on the MAR with my medication here, and it is lorazepam 2 milligrams IV, and I'm going to make sure that it's the right patient. Yes, Mr. Brown. The right drug, lorazepam, the right dose, 2 milligrams IV route, and time now, and the expiration date, it is within its expiration date, so that's good, and those are my 2 checks right there. Okay, just make sure I have everything. Alright, I'm washing my hands, and I'm gonna get these medications prepared. Trash. Alright, I'm gonna pop this top and hopefully not throw it. Okay. Trash and scrub for 30 seconds. And let that dry. And using the OK method here. Going to pull this off, and 1 milliliter of air is in my syringe, so this is dry, and I will insert this and the 1 milliliter of air, and then I will drop 1 milliliter of lorazepam. It's quite a bubble. I'm just trying up a little bit more to try to get these bubbles out. Alright. I've got 1 milliliter of lorazepam, and using the scoop method, I'm going to recap so that I can dilute it with the diluent. Alright, so I'm going to get my other syringe here, and okay. And since this is already, so I'd pop the cap of this trash and scrub this for 30 seconds.